Dear ladies and gentlemen, dear movie stars, we are now starting much more serious academic, I may even say, a session on undergraduate training on sexual health. During yesterday and even this morning, we heard that there are a lot of challenges in this area, that there are not that enough of collaboration and so on. So working group number 3 have done a lot, and this is the godfather of that work. This is the real inspiration, and Johannes Bitzer, who has done the most. You see even gray hair now after our great work. It has not been that easy, for sure, to work with us, quite a big team that were involved, but Johannes will tell much more. So the session about undergraduate training, try to grab out of that as much as you can to ensure that you can advise us for the final stage of this project. Please.
You're lovely. Thank you very much, Gunther. The kiss comes a little bit later. I just would like 5 minutes to give you a little bit of background of our work. What we found out is that in a large majority of European medical and psychology student curricula, there is not a basic education and training in sexual health and sexual medicine, so that these people are not prepared to counsel or care for individuals with problems. The other thing is that when we looked into existing programs, there is a huge variety of existing courses and curricula, and very much depending on the special interest of those who are giving the courses. And so it is, as you have heard before, one of the challenges to bring all these different aspects somehow together under the model of biopsychosocial sexual health and sexual medicine. And what is quite obvious that there is no real integration into the general curriculum. If there are courses, they are aside somehow. So we decided, let's go ahead and try to work on a curriculum which is, as it should be, competence-based with clear learning objectives based on 3 pillars, which is knowledge, skills, and attitudes. Let's think about the teaching methods. Let's think about how to evaluate and get feedback. And let's also think about how could it be implemented. So very briefly, because I think that is the measure of whether we succeed or not, is that we have to understand what are the competencies. We would like really that students can perform a sexual history, including assessment of sexual health risks and sexual concerns, encourage questions, and create an open, confidential, non-judgmental atmosphere following the principles of patient-centered communication and patient-professional relationship based on trust and respect. The other thing, they should be able to counsel patients on sexual health protection and promotion, encourage questions, and inform and educate patients and their partners about the basic facts of the physiology of the human sexual response in women and men and their partners. The other competence which we would like to teach is that they can address proactively sexual well-being and sexual function in a respectful, non-invasive manner, that they take care of patients with sexual problems and concerns in general, as well as in the context of disease by practicing patient or couple-centered counseling, and by informing patients about therapeutic options and provide referral if desired by the patient. And finally, they should be able, because it's a very very special skill, to communicate, educate, and counsel not only the individual patient, but have the skills to include the partner in the process in the dyadic setting. So 3 pillars. One is knowledge, one is skills, and one is attitude. And for each pillar, we would have to define the teaching methods, the evaluation for each of these 3 pillars. Very briefly, we decided for the first step to sort of subdivide knowledge into 8 topics: sexual health, concepts, definitions, the body and sexuality, sexuality and psychology, sexuality-related health risks, sexual dysfunction male, sexual dysfunction female and couple, medical illness and treatment impact on sexuality, and sexual health of minorities. And about these different topics we will talk today. Regarding the skills, it is well known that you have to develop these skills and train these skills of reassuring patient, of privacy, explain confidentiality, to ensure patient trust, comfort and openness, utilize empathy and build rapport, use open body language, be aware of patient's cultural background, avoid assumptions about sexual orientation, gender identity, etc. Use simple, direct language within your own comfort zone. Avoid unnecessary interruptions and disengage from too much sort of electronic medical record. The more specific skills, you all know about it. It's sexual history taking, which is not only about risk assessment, but also about well-being and quality of life, and also the communication in the context of disease. And to teach skills, of course, we need cases, we need written scripts, we need videos, we need possibly simulated patients or role play. So this is just to give you a little bit an overview of what the purpose of the curriculum is. And now I would really invite the colleagues to give a very brief overview about the different topics. And the first topic is presented by Osmo.
So in our curricula, naturally, there is, in the beginning, some very principles about what is, for example, sexual medicine and sexual health and other concepts that each student need to know to understand what curricula, what is it's about. And there are some learning objectives, and naturally we have taken these definitions and concepts from international organizations, especially from WHO.
Sorry, I have to open. It doesn't work.
Okay. All right, now it's better. And we also want to show what is the multidimensional aspects of this concept, and what are the dimensions of sexuality, and what are the variety of sexual expression, and what is the public health relevance of these issues and concepts, for example. And here are some examples of titles of our slides. We have at the moment 29 slides, so I only give you a few examples. I don't use your time so much. So you can see here some of these titles in these slides, like human sexuality and its elements. And also sexual health determinants, risk and resources, and definitions of sexual medicine, sexuality. They are important to understand what really is sexual medicine for students. So how they are linked to reproductive health and variety of sexual expression. There is a special slide about the gender unicorn. And finally, what should medical and psychology students know about sexual medicine? There is some other elements like also professional ethics that are included to these slides. And this is WH's working definition. I'm not going to read it because I believe that you have seen this somewhere else before. But it's important for students who haven't seen it. And there is also WHO resources, what are the linkages between sexual health and reproductive health. And this circle, it includes a lot of information. You probably can't see it, but this is something that students can see and think about how these concepts are related together and what are the main elements of these two issues that need to be considered. And there is also this kind of concept of framework understanding the drivers of sexual health. So we use a lot of WHO resources for students and with curricula. So what are the sexual health outcomes based on macro and micro and meso levels, for example? And I think that this is an important slide for students to understand what are biological factors, psychological factors, relationship factors, sociocultural factors, how they integrate and how they are important in all these aspects, both positive and negative ways, how they have influence on our sexual health. So risk and resources, a lot of information. And this is about what students need to know about gender identity, gender expression, physically attraction and emotional attraction, so how these concepts are related and how they should be understood. And we recommend a lot of different WHO's resources for the students to read. So there are concerning rights and law and communication and different problems that exist in sexual health issues. It is good to have this like a percentage briefly. And actually in our slides we stop here what medical and psychology students should know about sexual medicine. And that is something that starts with other topics of this curricula. So these things that are listed here are almost the same like what are the other topics that you will see very soon from the other persons have been involved with curricula. So this was about topic 1, briefly, very briefly.
We are now going to topic 2. I have to escape. And topic 2, as you have heard, is about biological aspects of human sexuality. And again, it is the work. Is it seen? No?
Slides are, yes.
No? Okay. It's the work of different colleagues. We have worked together. The learning objectives are actually that we believe that students should understand and know about the biological factors determining the male and female body from chromosome to genital organs, understand and know about the different models of human sexual response, know and understand the hierarchical multi-level organization and regulation of the sexual response, and know and understand the dual control model and the exciting and inhibiting pathways in the brain, the endocrine system, the autonomous nervous system, and the genital organs. So again, we have about 28 slides which really subdivide these different subjects: the making of the male and female body, the human sexual response, the hierarchical organization of the response, top-down and bottom-up, the regulation on the level of the brain, the endocrine regulation, the autonomous nervous system regulation, and the genital organ response, as you all know. We do have some slides about the issues from the genes to the body, to make students understand that this is a rather complicated way where in each step there are possible changes from the chromosomal sex to the gonadal sex to the hormonal sex to the internal reproductive structures, external genitalia, and on all these steps there may be changes occurring which make the bodies very different and not a strict sort of division of male and female. This is one concept. The other concept which we would like to teach is that it is a hierarchical system. There are different parts of the body involved. And here, for example, you can see we have some slides on this issue. What about what happens in the brain, what happens in the endocrine system and the main neurotransmitters, always under the model of the dual control, exciting and inhibiting. And I think to understand also the famous sexual response described by Masters and Johnson first and then differentiated, it is important that we understand that women and men, of course, it looks like the sexual response is different, but there is an identical pattern of arousal, which is the blood flow. And increased blood flow, vaginal and penile vessels in the cavernous and spongy bodies of the clitoris and the penis. So both sexes are quite close, and that the general vegetative reactions are the same. So on one hand, we would like students to understand what happens in the genital organs, but also to understand that this male-female opposition is rather relative. And finally, I think the main issue is really that we want to help them to understand that from the point of view of sexuality, we're always in a state between excitation and inhibition. And in the brain, it may be a disturbance to imbalance between excitation and inhibition, neurotransmitters. It may be an imbalance between exciting and inhibiting sexual hormones. It may be an imbalance between vasoconstriction and dilatation in the different so-called sexual dysfunction. Basically, an imbalance between activating and inhibiting pathways. So this is tried to bring this main message. It's both sexes are quite close, quite similar, that there is an hierarchical organization and that students may understand the basic principles of the biological action.
I'm very happy to be today with you and having the opportunity to share with you our work connected with the topic 3, psychology and sexuality. We were working on our slides, 29 slides, with great enthusiasm, and we were very dedicated while doing it. Osmo Kontula, Marianne Grace Sojka, Johannes Bitzer, and myself, Svetlana Zdravkovic. And now I will go quickly through our work so that you can have the image about what we were working on. First, I will tell you something about the learning objectives. We need to show our medical and psychology students something that they could understand and know about the importance of the relationship between psyche and sexuality. Then important things about the different psychological theoretical models of sexuality. Also about sexual development looked at from the psychological perspective. About psychological factors important for sexuality and sexual relationships. About therapeutic approaches to psychological and sexual difficulties, and also about the role of imagination and sexual fantasies for sexual arousal and good quality sexual functioning. In order to fulfill these goals, we have a structure of contents that now you can see on the screen. Within those 29 slides, we covered these issues. We are talking and showing the major theoretical models on human sexuality that include psychoanalytic and analytic approach, cognitive behavioral, biological, evolutionary, cultural, and social. We will also covering the issue of sexual development, talking about strands, aims, stages, and chronology. We are writing and talking about psychological factors important for sexuality and sexual relationship. We are giving the overview, and we are talking in great detail about the motivation, relation towards one's and partner's body and psyche, about love and passion, unconscious and creativity, about imagination and fantasy, fears, psychological and sexual difficulties, and sexual arousal. We also covered an important area that our students should know about. Those are interventions and psychotherapeutic approaches connected with sexual difficulties and disorders, and focused on sexual body, couple therapy, and psychodynamic approach. Now I will show you a couple of examples of our slides because the story is much, much longer. This is the example of our slide about sexual development, and here you can see the main strands, aims, and stages that we are going to teach our students about. Then these are the psychological factors important for sexuality and sexual relationship, the overview of the factors that we are discussing each and more of them in a longer versions. Of course, these factors include within themselves a lot of other significant notions and psychological features that are important for the relationship between psychology and sexuality. This slide talks about the needs and dimensions of loving relationship and the possible conflicts. You can see this pyramid that is covering the issues of intimacy, passion, and commitment, and how the relationship looks if it is functioning well, and what are the possible dangers and the ways of getting out from the complicated situations. And for the last slide, we chose psychodynamic approach to psychological and sexual difficulties because some patients are suffering from traumatic experiencing from their childhood, such as being abandoned, offended, or humiliated, or abused, not only in the childhood, but during the life course, of course. And these experiences can, of course, leave scars that could influence their future sexual and life in general. So therapy can help patients to integrate traumatic experiencing into their life stories, separate past from the present, and to have a much better quality sex and life in general. Thank you.
The next topic is topic 4. I think we are still in time. It's again a work of a group. Unfortunately, Trojan and Svadro are not here, and Thierry was kind enough to leave it to me because a little bit of the English issue. And as you see, the topic is about sexuality-related health risks. Our learning objectives are to know about the problem unplanned pregnancies and the impact on sexual health, know about STIs and the impact, know about sexual violence, prevalence, manifestations, risks, prevention, care for victims, know about sexual dysfunction and sexual discrimination in general, and the public health and individual strategies of prevention and promotion. Again, we had about 28 slides, which include the same factors are active in many risk behaviors, the 4 big threats to sexual health and their interaction: unwanted pregnancy, unsafe abortion, STI, sexual violence, and sexual discrimination. And on the other hand, what are the preventive strategies on a public health level and also on an individual level? So from politics, laws to individual behavior and care. This is this multidimensional model where you have individual factors which are important for risk behavior. You have environmental factors which are called sort of mesodeterminants, and you have the micro factors which are very much related to the society and social-cultural norms, and especially the patriarchal societies. So we always want to teach, the students that these threats to sexual health have large consequences on physical morbidity, destruction, on mental health morbidity, and on socio-culturally mediated morbidity. And in a more narrow sense, of course, they can lead to sexual dysfunction, pain, aversion, isolation, suppression of sexual experience, and gender dysphoria-related suffering. So what are the solutions? On the On the public health issue, it's about sexual and reproductive rights, the sexual and human right education, and that you have the different fields of contraception, safe abortion, STI, HIV protection, and detection of sexual violence and care of victims. We think it's important to give them an overview about what is meant by sexual rights, and as you can see, that's a long list. I'm not going to in detail, but our purpose is really to make students understand that sexual health is something that needs protection, that needs promotion, that there are threats to sexual health, and what are the strategies on a public health level and also on an individual level to maintain sexual health and to promote sexual health. So now we come to the next topic again. And I really apologize for the fact that I continue to talk, but Evi Kerana is not able to be here, and yeah, I will talk about the topic 5, if you allow me, which is female sexual dysfunction, and here we are again. Working together with Efi and others on this field. The learning objectives are know the sexual response cycle and the related dysfunctions, desire, arousal, orgasm, pain, understand the biopsychosocial model of understanding, understand the descriptive diagnosis and the explanatory diagnosis, know about the basic therapeutic tools, medical, individual psychological, couples-oriented interventions, and be able to diagnose a female sexual dysfunction and inform about treatment options without, of course, necessarily doing it themselves. We have again the slides in a rather structured way that you have the classification of the dysfunctions, the risk and contributing factors, the descriptive and explanatory diagnosis, the desire disorder, and for each disorder we have a case which is then analyzed according to diagnosis and possible therapeutic interventions. It's about desire, arousal, orgasmic, and sexual pain. Just some of the slides, it is important to understand that many of these dysfunctions overlap. It is very important, as Ellen Lunn has nicely shown, and others also, to try to understand the biopsychosocial model of human sexuality, the body, the mind, the partner, and the environment, and that students get an impact that there are diagnoses in the ICD-10 for sexual dysfunction, but that it is even more important to understand the contributing factors on the biopsychosocial model, which we know from psychosomatic medicine, and that they understand the basic therapeutic concepts are also very often a mixture. It's about basic counseling, which is very important, which deals with information and education, help understand the problem, and that is what we call empowerment. That patients really understand what is going on and what the problem is. And of course, you have always these sort of 3 pillars of therapy, which is medical interventions, which is the psychosexual interventions, and which is physiotherapy, with specific subgroups, which of course very often need specialized knowledge. But students should just understand that these are the instruments which are available. Maybe some of them will be able to learn it, otherwise they will be able to refer to others. And this is the structure. You know, a 47-year-old woman comes to the office, doctor, is this normal? I have lost interest in sex. If it were not for my husband, he's very nice. And then in the slides we work up these different cases.
Thank you, Johannes. So, of course, it's really a group effort together with Bruno and Evie under the leadership of Professor Bitzer. So we were, just like the other overview, we were defining the learning objectives, and we had a lot of talk about, because we were targeting the undergraduate And we were then deciding, well, if the undergraduate, well, what does really the specialist need to know? And so we can define what the undergrad needs to know. So one of the things is, of course, the definition of male sexual dysfunction, know about the prevalence and the contributing factors of low desire in men, and also the diagnostic tools and therapeutic options. Of course, the most frequent male sexual dysfunctions with our erectile dysfunction and ejaculation disorders like premature ejaculation and delayed ejaculation. And of course, last but definitely not least, the basic understanding of dynamic of the intimate relationships. So we made different slides about the male sexual dysfunction, and we described for every main topic that we just mentioned what they should know: prevalence, contributing factors, diagnosis, and treatment options for all of the dysfunctions that we describe in the slides. And of course, we all know that the etiology of erectile dysfunction is multifactorial. What we also stressed out is that we should know the precipitating and maintaining factors for low desire, to recognize them so that you can know how to address them in a proper way. And like Johannes showed us, there are really 3 pillars of care. The first being medical interventions, psychosexual interventions, and of course physiotherapy, and always propose a tailored treatment for the patients. We developed also slides for ejaculation disorders and how to address them. And of course, I said last but definitely not least, we should know about the basic psychological and behavioral therapy modalities for couples. And of course, not only heterosexual couples, but also other couples. Thank you.
The next topic is sexuality in the context of diseases. Again, the colleagues are not here to share these slides, so I will try to bring it to you. It's what we generally call some sort of medical sexology, and here you can see that again. This is a work of several people. The learning objectives know about the different possible interactions of diseases with sexual physiology and sexual well-being, know about the general principles of sexual health care in the context of disease and treatment, know about the impact of cardiovascular disease, cancer, neurological disease, psychiatric disease, very basic knowledge. We have produced these slides with looking into the general impact, the general overview, cardiovascular, metabolic, cancer, neurologic, and psychiatric disorders. And we have one slide to understand how can the symptom, the sexual dysfunction, be understood in the context of a disease, the pre-existing sexual difficulties, the threat of the disease and therapy-specific factors, and the individual response of the couple to the disease. So all these factors will finally determine whether there is a sexual dysfunction syndrome or not. And as in sexual medicine, it is very important to understand that it's not only about stresses, it's also always about resources and resilience. The stresses, of course, are many of them, but also to understand that giving meaning to the disease, optimism, fighting spirit are important contributors of resources to maintain and regain sexual health or sexual rehabilitation. We try to teach also the doctors working more in the field of medicine to understand the different dimensions on which a disease can interact. It can be a destruction, a disfigurement, a disability, a dysfunction, a dysregulation, a disease load. And we have different examples here, for example, from cancer, looking into the treatment, the side effects of the cancer treatment. And then we try to give them just a brief overview how we can help patients with an oncologic disease, to encourage the patient to talk about sexuality, listen to the story, take a sexual history, and then understand the disease-related factors, the biological and the psychosocial factors, but then also look into possible interventions that could help, for example, in the cardiovascular disease category, and including, again, medical and psychosocial interventions. Thank you very much.
So, as you have all seen during these 2 days, even among sexologists, there is still this topic that is undervalued, and we have not met all the concerns of sexual variety people or sexual minority people. And we think that it is very important to teach our undergraduate psychology and medical students of the whole world of sexual variety that is there behind the heteronormativity. So we would like to introduce them with some basic elements of this kind of work. So to know about the definitions and prevalence of LGBTQ, but we miss here plus or asterisk, because nowadays we have LGBTQI, and we believe there will be more and more abbreviations added to it, so we sign plus there. To know about the special sexual health risks and resources for these people, because we know that both LGBTQ plus people have some special sexual health risks, but also people from the LGBTQI variety have some different outcomes from the heteronormative people when having the same diseases, and to know about the specific health needs of the responses to their needs. So we will provide them in the 28 slides about the definitions of LGBT, about the prevalence in the population, about the legal framework that is very different across different countries. Although in Europe it is not so different, but if we look beyond Europe, there are even countries that people who are homosexual are sentenced to death. And there are many, many societies that face these problems nowadays. We will teach them about sexual health risks and resources and about special health needs that they have, specifically for homosexual people, transsexual people, and intersex people. So here are some of the slides. I will not go into the details, but the gender unicorn that was introduced by Osmo earlier, which is a very important information to give to our students, and on two behalves. First, to see that sexual expressions are different and that we have different elements or the different aspects of our sexual identities, but also they are sometimes overlapping. And in the recent years, there has been some more overlapping and some more titles and some more definitions introduced into this, like demiosexual or sapiosexual, and then we have this emergence of all these different identities, roles, and sexual orientations. LGBT people were differently treated during the history in classifications, from medicalization to anti-medicalization in the recent years. So these are some of the slides that we will share with our undergraduate students. Thank you. So there was heated discussion whether to keep paraphilia inside LGBTQI plus population or outside it, but because it's more related to legal aspects and forensic sexology, we finally decided to separate it from the previous aspect. And paraphilias are, I believe, the classification part in both classifications that has changed the most in the recent 50 years. You don't have another group of disorders that has been changing so quickly and that has been removing or adding new categories into it as much as paraphilias. So we will try to give definitions to our students to show them how they changed during the last several years. also what different paraphilias can be about, and also to introduce the difference between paraphilias and paraphilic disorders, because this is very important, because paraphilias are just a part of sexual variety, and it should be more included into the LGBTQ plus population, whereas paraphilic disorders, as they are defined today, have much to do with legal aspects, because they are in ICD-11 and DSM-5 classified only if there is a high personal distress in a person, or if there is no consent with another person. So there is this legal aspect of paraphilic disorders. So for this reason, we decided to separate it from other varieties. Also, we will give a very brief introduction into how to diagnose paraphilias and what are the treatment options. We don't expect medical students nor psychology students to understand all the complex treatments, and they're not going to treat these people, but only to give them the information that there is possibility to treat these people if they are willing to, and sometimes even if they are not willing to, but are sent by the court.
So, Johannes, if I can just to say that the Multidisciplinary Joint Committee on Sexual Medicine, which is a body of the UMS, is very happy to start this collaboration with your organization. And I think that all the 5 boards which are encompassed in our joint committee, the dermatology and venereology one, endocrinology, obstetrics and gynecology, urology and psychiatry and endocrinology are also those representatives are very happy of it. I'm also looking forward for having the possibility to meet the friends, many of you, the friends I know in person, to meet personally. Now, unfortunately, there is an overlap with this Congress in Bologna, so that's the reason why I was not able to reach you and to thank you for the invitation so kind. And really, I think that we may work very well together. The aim of the Joint Committee on Sexual Medicine is very much closer to your aim, absolutely. And we are doubling our chances to have a sexual medicine teacher in the universities of Europe, in the School of Medicine, as well in the School of Psychology, working together. So this synergic effort will be, I'm definitely sure, will be the unique way to reach the success of it. So thank you again for the invitation. I'm sorry that I'm unable to stay anymore with you.
Yes, no, thank you very much for having us as part of this. And this is a really impressive effort, and it's wonderful to see. I mean, we have an embryonic element which is overlapping a little bit with what you're doing in terms of a postgraduate diploma that we are putting together. So we are very much in a much more unformed state than yourselves, but I can see that already, having learned a fair amount from what you've done, but also noting the overlaps in the way that we are thinking. So I think this is really productive, and we are very appreciative to be able to be working and to be part of this.
Especially appreciate the attitude aspect that comes into the curriculum. Although it is something that also happened in the hidden curriculum, that was for me quite interesting that you actually lift it out and say that's something specifically to work on.
I think I'm here because I'm representing the International Society for Sexual Medicine, and I just want to congratulate. It's a very, very ambitious program. And what I really like is that you actually have the same program for medical and psychology students, because I think that's such an important message to send, that we don't have like one curriculum for psychologists and one for medical students, but we think that they all need to know about this because we have the biopsychosocial approach. I was thinking about, I think that there's a very good idea of collaborating with the ISSM, because we also have a lot of focus on education. We have what we call our university, where we have like online modules about almost all the topics that you're presenting. So I think I was thinking, is there a way that collaboration can also use that something has already been created? Do they need to learn it in person? Is there something you can do online? I think there's so many ways that we can think about how do you give out, or how do you practice this curriculum, which is very, very ambitious. It was very, very impressive. I'm very impressed about all the work you have done in that. So I think that there's so many good ideas here. So it was really a pleasure to be here. And I really like that you added the paraphilia, because I think that it's so important that we also teach our students about what is not what they normally see, so they are able to talk about it and not like feel that they reject people when they start to talk about something that's a little bit outside what they usually see and hear about.